Ulnar nerve pain. So our ulna bone right here is also following the pathway of this ulnar nerve that goes to your little pinky. So if you're having some pain in this pinky, it might be feeling numb or pain shooting down to it. What we want to do is we want to follow this nerve pathway from your neck down to your arm and see if we can get it feeling better. So the first place that we want to get after it, as it travels down your neck, it goes between these two neck muscles called your scalenes. And so I want you to find something. You don't actually need anything, but a ball works pretty good if you got a grippy ball, and you can put it just underneath your collarbone right here. And so those two neck muscles go to ribs 1 and ribs 2. And so it doesn't matter if you're kind of in the middle or out towards the outside a little bit, but I want you to pin it down. You can also do that by just kind of reaching into your collar and grab it onto the skin. I want you to look up and away. And as you do that, if you've got those muscles pinned down really well, you should be able to feel them stretch through your neck right there. So just looking up and away, stretch those fibers and take the tension off. So look, add pressure, and bring it back. And I want you to do that 10 times and see if that'll loosen up. So there's the first place. The second place is under the pec minor. So right there, just a little bit further down, it comes off of the shoulder blade. It has a little bony process right there. And then comes to ribs 3, 4, and 5. So I just want you to take your fingers. I want you to dig back and forth. And just work on that area. Maybe even grab your thumb, stick it in there, and specifically strum some of those fibers and try and free that up. You might even bring your arm back, make it go tight as you're strumming those fibers. So do that for a minute or so. And the next place is through this tricep area. So one thing that I like to do is you can grab something cylindrical. You can grab a rolling pin, you can grab a baseball bat, and you can lay your arm over top of this. And so you're going just right above your elbow and laying your arm on top of it and just going up and down, or a little bit of rotation in and out. And actually a really great place to do this is in the kitchen with a kitchen chair. So you can sit in one chair and you're just going to put your arm over the back of the other chair and just working those tissues right there. Your tricep has 3 muscles that go to one tendon that goes past your arm, elbow there. And so I just want you to free up some of that nerve pathway. This might hurt a lot. And so just work those tissues back and forth and up and down. So do that for about a minute. And the next place you want to work is the flexor carpi ulnaris. So what that's going to do is that's going to go from your elbow down towards your pinky. So I like to get just a little dab of lotion. Put some lotion on there, grab some kind of scrapey tool, and I just want you to work those tissues up and down. There's not exactly a right or wrong place here. If you really need this, it might feel pretty crunchy as you're running over those fibers. And so I usually go from the elbow up towards the wrist. Mine's being pretty crunchy. Then I'll work it down the other direction. And we've got some wrist flexors here. We have some wrist extensors back here. And then that one straight on the side. Just trying to free up that pathway there. As you can see, it's starting to turn a little bit red. So work those tissues. The lotion helps so that you don't overdo it on the skin and hopefully don't create any major blood rupturing capillaries there. And then the last thing that we're going to do is just working it down through that pinky area there. On the top, on the side, on the bottom. And again, just working that, grab that lotion, working those fibers up and down, get some good blood flow, break up any little adhesions you have there, like that. Then for stretches, I want you to take that arm, bring it back behind you, grab that elbow, pull it back, sit up tall, and then lean away. We're trying to get this tricep to stretch, so really try and reach back as you're leaning. Give it some tension for 5 to 10 seconds. Back it off. I want you to do that 5 times. Stretch that tricep out. And the last one is just putting your hand on the table, turn those fingers inward, put your other hand on top, and I just want you to try and rotate that elbow back towards you. So again, fingers are turned in, hand on top to hold it there, elbow goes straight, and then trying to rotate that elbow back and out towards you. Trying to get the outside of that arm to stretch. And that's the stretch for the muscles and the stretch for the nerve. It looks kind of funny, but you're going to make a circle. And then you're going to try and put your fingers upside down on your cheek and then rotate it up as if you're going to look through that little hole through the circle. And again, you're just going to put pressure on to the nerve, pressure off, pressure on, pressure off. Want you to do that a few times. If it gets pretty tingly, stop. Don't make it too tingly. So maybe try 5 to 10 repetitions. Okay, hope that helps that ulnar nerve and gets some of that entrapment moving along your arm. Great job.